Good afternoon, students. The topic of our lecture is diseases of internal organs in the wounded, visceral pathology in gunshot and mild explosive wounds. Gunshot injuries occur when someone is shot by any sort of projectile from a firearm. Occurs in criminal and terrorist incidents, suicides. Mechanism: by bullets getting out at speed of up to 150,000 meters per second. It depends on type of gun. Head and torso are the most vulnerable areas. Ways to inflict an injury: along the track, kinetic energy, deformation, fragmentation, entrance profile, way throughout the body, and secondary contamination. Chest injuries: penetration of the chest may damage pleura, lung, great vessels, heart, mediastinum, diaphragm, and abdominal contents. Wounds of the intercostal vessels or heart can cause massive hemorrhage. Stuck-in chest wounds must be closed immediately. Relieve any tension pneumothorax by needling the chest on the site of the suspected lesion. Infection: risk is reduced by early drainage of hemothorax, delayed closure of wounds. Abdominal injuries associated with a high incidence of internal injury. Penetrating wounds of the abdomen require full exploratory laparotomy. May be occult bleedings or perforation of bowel. May occur peritonitis, and it's necessary to use broad-spectrum antibiotics. Limb injuries can occur nerves, tendons, vessels. Test for pulse doesn't exclude atrial injury. Note sensation and sweating. Surgical repair should be used. Explosive wounds cause injury by the blast wave, blast wind. Central injuries: limbs are traumatically amputated. Blast lung, tympanic membrane perforation, and secondary missiles. Fragments of the weapons, glowstones, and other people. Antipersonnel mine injuries: traumatic amputation or disruption of the contact foot. Other leg is severely injured. Hematoma, edema, pus, skin loss. Hand injury may occur by poor training and poor quality of weapon. Mechanism of blast injury: damage occurs when the blast wave compresses the tissues, as the tensile strength of the material. Spreading of vascular beds. Pulmonary contusions, gastrointestinal hemorrhages. Ear is the most easily damaged in blast injury. Ear damage: rupture of the eardrum, hearing loss, pain, tinnitus, dizziness, blood in the external canal. Auditory barotrauma: fracture of the tympanic membrane is a marker for serious gastrointestinal or pulmonary injury. Pulmonary damage: the most common fatal injury. Pulmonary contusion, pneumothorax, pulmonary interstitial emphysema, pneumomediastinum, subcutaneous emphysema, systemic air embolism, shock, myocardial infarction, spinal infarction, cerebrovascular accident. Clinically, pulmonary damage. The patient will have chest pain, dyspnea, bradycardia, hypertension, cough, hemostasis, hemorrhage, bowel necrosis, pneumoperitoneum. Colon is the most common site of hemorrhage and perforation, the most bowel gas accumulation in the gastrointestinal tract. Clinical signs: absent bowel sounds, bright red blood, pale rectum, abdominal pain, nausea, vomiting, diarrhea, tenesmus, rectal pain, and testicular pain. Crush syndrome, traumatic rhabdomyolysis, Buerger's syndrome. Crush syndrome is a medical condition characterized by major shock and renal failure after a crushing injury to skeletal muscle. Reperfusion syndrome is the most devastating systemic effect without proper preparation of the patient. Monitor for the classic 5 Ps. It is pain, pallor, paresthesia, pain with passive movement, and pulselessness. Treatment. In treatment, there are 2 recommendations. Not release victims of crush injury who have been trapped for more than 15 minutes. Treatment consists of not releasing the tourniquet and fluid overloading the patient, or release the crushing pressure as soon as possible. Avoid using a tourniquet and consistently monitor the vital signs of the patient. Wounds. Wounds are the mechanical damage of the organism which occurs from destroying the integrity of the covered tissues, skin, or mucous membrane. During this damage, these can be destroyed more deep tissues, inner organs, internal organs, damage of the brain, liver, stomach, kidney, and others. The main features of the wounds are pain, bleeding, hiatus. Their development depends on the localization of the wounds, mechanism of the damage, volume and deepness of the injury, and common condition of the patient. Classification of the wounds: cut wounds, stab wounds, contused wounds, lacerated wounds, crushed wounds, slashed wounds, bite wounds, mixed wounds, and gunshot wounds. Gunshot wound. Classification according to the level of infection. This wound can be rhabseptic, fresh infected, and suppurative. Peculiarities of the treatment of gunshot wounds. During the treatment, much attention is paid to creating of optimal conditions for oxygenation of surrounding tissues, which helps to minimize the zone of necrosis, which serves as a nutritive medium for bacteria, and to decrease the risk of development of anaerobic infection. General treatment is different only in increased antibiotic and desintoxicative therapy, which is necessary in massive volume of necrotic tissues. Thank you for your attention.